guys, this is Manu and Kalia, physical therapist and Ayurveda herbalist. So I wanted to address a common question for those of you who are having a lot of knee-related problems, chondromalacia patella, and patellofemoral problems, and having difficulty with doing a lot of squatting movements. So part of it has to do with the alignment of the knee, the angle at the knee, how much weight that puts on your knee as well as the kneecap area. So what you want to keep in mind is, ideally, of course, you want to do your non-weight bearing strengthening first for these kind of conditions before, and you want to have adequate hip and glute strength before you're progressing on to squatting and weight bearing exercises. But when you do decide to, and you are able to start doing some weight bearing, or for a function, if you want to squat and pick up something, what you want to keep in mind is this. So I'll do it in a side view so you can get an idea. And we'll use this as an example. So imagine if there is a stick that's in line with my ankle and it's going straight up, right? So if I decide to squat and if I bend more at my knee, so if I squat this way, bend, so my knee drifts forward, now there's a lot more load going through this joint, especially that patellofemoral joint. If you have chondromalacia patella, puts a lot of pressure through that area. Okay, so what you want to keep in mind is, ideally, as much as possible, not letting that knee go too far forward when you're doing that squatting movement, whether to pick up something off the ground or for exercise purposes also. So what you want to think about it as is doing more hip flexion. So you're hinging more at your hip. So and you might want to bring your feet wider apart, so that way the pelvis can sit back into that position. So when I do hip flexion and I stick my butt back and go back, now the knee doesn't drift as far forward. So a lot more of the load is on my hands, my glutes, and this region, as opposed to through the kneecap. Okay, so this might be a better position. So once again, you want to make sure when you're squatting, you stick that bottom back and you're hinging more at your hip as you come down. And it'll still allow you to do some strengthening and some quad work, or reduce the distance you're going down. So you could do just partials through here, so you get used to firing up these muscles through here without putting too much compression and load through that kneecap and the knee. All right? So I hope you found that helpful. And if you have any questions, make sure leave a comment. Click on the link below to check out my site and subscribe to the channel. Thanks.